To build on that video, let's look at two examples of systemic racism, both of which I mentioned very briefly earlier. The Government of Canada passed the Indian Act in 1876. Indigenous people had colonial education in the form of residential schools legally imposed on them. This education, for which children were forcibly removed from their communities for the duration of each year and separated from family members, required students to adopt a new religion, new language, new way of dressing, and largely stigmatized and erased their own identity, heritage, and existing institutions. Over 150,000 children were forcibly removed from their family and sent to one of 130 residential schools. The last residential school was closed in the mid to late 1990s. Over 6,000 children were killed in residential schools. These children are commemorated in the UBC reconciliation pole, shown here with one copper nail for each child. The Chinese head tax was levied on Chinese immigrants to Canada between 1885 and 1923 under the Chinese Immigration Act. Chinese people had to pay $50, later raised to $100, and then $500 just to come to Canada. Think about how much money that would have been in the late 1800s and early 1900s. Chinese immigrants were suspended altogether in 1923. The act was repealed in 1948. However, the Canadian government didn't officially apologize for and redress its discriminative head tax until 2006. So, reflecting on the example of racism under COVID that you gave at the beginning of our lecture, do you think it's an example of individual racism or systemic racism? Take a minute to review these definitions and then post in the annotations in class. When it comes to systemic racism, we cannot leave out systemic racism against Black communities and Indigenous communities in North America. So, I'd like to situate this module within current events, specifically the Black Lives Matter movement in North America. The recent deaths of George Floyd, Ahmaud Arbery, and Breonna Taylor in the USA have sparked a new wave of protests over the past few weeks under the Black Lives Matter banner. Black Lives Matter campaigns against violence and systemic racism toward Black people. The International Human Rights Campaign began on social media in 2013 with the Black Lives Matter hashtag, and has since gone on to lead calls for Black people to be treated fairly by authorities in the United States as well as around the world. The campaign was co-founded by 3 Black women, Alicia Garza, Patrisse Cullors, and Opal Tometi, as a response to the police killings of Black people. The phrase Black Lives Matter was first used in a Facebook post by Garza after Zimmerman was found not guilty, and was the inspiration for the campaign. According to Alicia Garza, quote, "Black Lives Matter is an ideological and political intervention in a world where Black lives are systematically and intentionally targeted for demise. It is an affirmation of Black folks' contributions to this society, our humanity, and our resilience in the face of deadly oppression," unquote. In the United States, both the police and the coronavirus attack Black people disproportionately. Scientific studies confirm that African Americans don't just suffer higher rates of police brutality, racial profiling, and mass incarceration compared to white people. They also suffer higher rates of mistreatment in U.S. hospitals, clinics, and physician offices. The systemic racism against Black communities and racial inequities have been exacerbated under COVID-19. Earlier in April, an analysis by the Associated Press found that 42% of COVID-19 related deaths in the U.S. are Black people, double their share of the population. In the module, Social Determinants of Health, we looked at the most recent data from APM Research Lab, a Minnesota-based research and analysis firm. The analysis showed that Black Americans are dying of COVID-19 at a rate that's 3 times higher than white people. In other words, statistics have shown that Black communities are amongst the hardest hit, while Indigenous communities are the second hardest hit in some places. In Canada, the health of Canada's Black communities has also long been a concern, and there are more Black people living in Toronto neighborhoods that have the highest numbers of COVID-19 infections, indicating that there are health inequities due to anti-Black systemic racism. It's important to recognize that in Canada, race-based data about which groups have been impacted by COVID-19 hasn't been collected. Toronto Public Health announced on April 22nd that it would begin to collect this information so it can address health inequities. However, using Toronto demographic data alongside new data about which neighborhoods in Canada's most populous city have the most coronavirus cases, Global News found a strong association between high coronavirus rates and low income, conditions of work, visible minority status, and low levels of education. There was an even stronger association between neighborhoods with a high number of coronavirus cases and those with a higher population of Black people. This again demonstrates how socioeconomic status and race and ethnicity impact health outcomes in an intersectional way. Worse health outcomes for Black people have only been exacerbated by the coronavirus pandemic, and more robust data is needed to fully understand how COVID-19 has disproportionately impacted Black people specifically. Professor Richardson already introduced some sociological explanations for race and ethnicity differences in health. The institutional racism, structural inequality between white and other racial minority groups, and the prejudices and stereotypes embedded in our healthcare systems can lead to unfair treatment of Black communities in a health context. Besides the COVID-19 crisis, the anti-Black and anti-Indigenous racism crisis is also rising in the US. Anti-Black and anti-Indigenous racism can take various forms, from racial profiling, carding, planting evidence and over-arrests, to harassment, physical beatings, sexual assaults, and killings. Black people are 3 times more likely to be killed by police than white people, and 1 1/3 times more likely to be unarmed than white people. Each year in the US, the top spot for those killed by police alternates between Indigenous and Black peoples. But this is not just a US problem. Canada has race-based police violence as well. According to an extensive investigation on fatal encounters with police in Canada over a 17-year period from 2000 to 2017, CBC Deadly Force found that while Black people are less than 3% of the population, they were 9% of those killed by police. Indigenous peoples were less than 4% of the population, but more than 15% of those killed by police. In places like Toronto, Black people are 20 times more likely to be shot dead by police. Indigenous peoples are twice as likely to be killed by police than white people. And in Quebec, almost 10 times as likely. In places like Manitoba and Saskatchewan, Indigenous people represent 58 and 62% respectively of those killed by police. During the global pandemic, the Winnipeg police killed 3 Indigenous people in separate incidents over just a 10-day period, one of whom was a 16-year-old girl, Aisha Hudson. This is a photo of participants carrying signs, flags, and beating drums in a peaceful gathering to call for justice for Aisha, who died after being shot by Winnipeg police. When vigils and protests were organized in Minneapolis and around the United States to demand police accountability, news reports soon carried images of property destruction and police in riot gear. Media and journalists have lots of power in framing Black Lives Matter protests, and this framing can have a large impact on the general public's opinions about the movement. Media can frame the movement as disruption, protest cause, or can echo Trump's label on protesters as thugs. The latter framing would take the emphasis away from the destruction of the protests and toward the issue of police impunity and the effects of racism in its many forms. Dr. Danielle Kilgo and her co-author conducted research on media coverage of protests in the US. Their research shows that some protest movements have more trouble than others in gaining media legitimacy. And protests about anti-Black racism and Indigenous people's rights received the least legitimizing coverage. They are more often depicted as threatening and violent. In fact, the usage of terms like thug and the equation of Blackness with criminality is not a new phenomenon in America. Thug is a race-coded word that fuels anti-Black racism. Misconceptions and prejudices manufactured and disseminated through various channels, such as the media, include references to a brute image of Black men. Documented historical accounts have shown how myths, stereotypes, media framings, and racist discourses further contributed to discriminatory policies and court rulings that fueled racial violence and culminated in the exponential increase of Black men's incarceration today. Despite being hit most by COVID-19, many Black men feel wearing a mask is a bigger threat than the coronavirus. Vicki Mays, Distinguished Professor of Health Policy and Management at UCLA's Field School of Public Health, studies health disparities and has been tracking incidents where Black men wearing masks were harassed. In an interview, Mays shared that, quote, "We have African Americans who have been dragged out of stores, who have been ordered by police and store guards to pull their masks down or take off their masks," unquote. The question becomes, which do they choose, COVID-19 or police shooting? Mays continues, just as Black individuals are more likely than white people to be stopped and frisked, to be pulled over for traffic violations, and to be charged with drug crimes, Black individuals also appear more likely to be targeted by police for simply wearing masks. In a heartbreaking calculus, many are choosing not to wear them at all, unquote. And such choice puts Black communities at a greater risk of COVID-19. Speaking of wearing masks, there are increasingly more and more people in Western societies wearing a mask primarily as a protective measure. It has become a marker of social responsibility and good citizenship. However, mask wearing is seen differently when worn on racialized bodies. While wearing masks while Black is often seen as unsafe, Asian individuals wearing masks are often seen as contaminated. Rather than exemplifying a commitment to the public good along with their white counterparts, an abundance of pictures of Asian individuals wearing masks may have accelerated the circulation of derogatory yellow peril stereotypes. Yellow peril is a racial construct used extensively in Western countries against Asians who were viewed as a threat to Western civilization. In this discourse, Asians, particularly Chinese, are seen as people who spread the disease, as impure, unclean, uncivilized, cultural polluting, and contaminating, and thus unfit for Canadian or American citizenship. COVID-19 has exacerbated the yellow peril discourse and anti-Asian racism. Reports have shown that racist hate crimes, including physical and verbal assaults and vandalism, have escalated along with the pandemic. A recent study also shows that East Asian Canadians face a disproportionate mental health impact from the COVID-19 pandemic as a result of targeted racist attacks, violence, and discrimination. The main focus of today's class, which I will introduce now, is racism, particularly anti-Asian racism under COVID. We will first start with examining racially motivated acts and anti-Asian discourses during COVID-19, and contextualize contemporary anti-Asian sentiment within historical Asian exclusion in Canada. And then we will learn how to use sociological concepts and theoretical tools to conceptualize the nation state in order to better understand the symbolic racial boundaries created under this pandemic. This class features guest speaker Dr. Amanda Chong. Dr. Chong is an assistant professor of sociology at the University of British Columbia. Her research examines links between legal status and the reproduction of inequality, with a focus on undocumented migrants, stateless persons, and refugees. Here are some key questions to focus on as you engage with Dr. Chong's lecture.